Welcome to today's press briefing. With us today are Dr. Chong Shuk Kwan, Head of Communicable Disease Branch of CHP, and Dr. Gladys Kwan, Chief Manager of Hospital Authority. The two doctors will bring up today on the COVID positive situation. Dr. Chong, yesterday the total number of COVID positive cases stands at 2,773. 1194 are PCR test positives. 1579 are verified RAT test positives, and there are 219 imported cases, and 195 by PCR and 24 by RAT verified test results. In the fifth wave, the number of positive cases stands at 1.258423 billion, and 9,121 have been reported by the HA. The total number of positive cases in the fifth wave stands at 9199 cases. Hospital Authority. There are 924 COVID positive patients being hospitalized. 134 are new COVID positive patients. For those isolated, 327 are in the isolation wards, 19 are the second tier isolation ward, 290 are at the North Lantau Hospital ICC. Altogether 97 are newly confirmed patients. We have 3 patients in critical condition and 3 in serious condition. For those who are in hospital for COVID, 20 are in critical condition, 27 in serious condition. 5 critical patients are in ICU for treatment. We have reported 2 deceased cases, 1 male and 1 female, 70 and 85 respectively. Both came from a care home, one with 3 shots and the other one unvaccinated. For the 219 imported cases, 115 were picked up from the airport. 83 were picked up from the quarantine hotels, and 21 were picked up after they've left the quarantine hotels. The CT values are high for majority of them. For imported cases, well over 10 countries are involved. The UK 58, the US 22, India 21, Singapore 16, Thailand 13, and for the other countries they have less than 10 in the number of imported cases. For care homes, there is an RCHD Hong Chi Oi Dong home. There are 3 residents and 1 staff member who came down with COVID, and for the other 18 residents in this home, they have to be quarantined. For schools, there is a special school, Hong Chi Chong Lang School in Tai Po. There is a student whose family member got infected, and he's close contact who tested positive. There are 4 students in that class, and all of them, the class has to be suspended for a week. For the mutant strain, BA.2, 0.12.1, there are, for local cases, there was 46, and 34 are untraceable, and 12 are linked with other cases. For BA.4 and 5, there are 9 cases, 6 are linked, and 3 don't have any known source of infection. They are living in Hanking Court, Carview Road, Bolton Terrace, 1 King House, and New Twin Moon Center, Block 6. That's all from me for today. By way of correction, yesterday we reported 3 patients in critical condition, 7 in serious condition. Beg your pardon. Yesterday, 100 patients have recovered, and 94 have been discharged since the 5th wave. 52,821 have recovered. 52,539 have been discharged. Since the early part of 2020, we have 65,201 patients who have recovered, and 64,919 have been discharged. There are 2 patients who were picked up upon admission screening, and 18 ward mates are classified as close contacts. So staff members, 25 more came down with COVID. A total number of patients who got infected stands at 24,731. And 12 have recovered and returned to the post, taking the total number to 24,375. For POH Tin Ka Ping ward, there are 2 staff members who got infected. There are no new cases today, but for the 2 patients, they are receiving isolation treatment in Tumen Hospital in stable condition. For the POH Tin Ka Ping Infirmary, there are 2 wards in which 2 or 3 staff members shows a sign of infection, and they tested COVID positive. Our infection control unit will establish the link. As a precaution, all the staff members and patients have to undergo testing. That's it from me. Now it's time for questions. Please identify the organization you represent. The lady over there at the back, please. Doctors, now TV. This morning, the Secretary said that for the Leave Home Safe app, it has to be on the basis of real name. Now, there is such a function with regard to the vaccination record. How effective this measure is going to be in terms of fighting the pandemic. Also, the social distancing measures will not be serving really effective measure. And are there any more measures? Now, there are more BA.4, 0.5 positive cases. Some experts said that this is fast becoming the prevalent strain. Is it likely that the number will be surging even faster? Well, regarding the policy mentioned by the Secretary, I don't have anything to add. I'm sure that if there are any new measures, there will be an announcement. For BA.4 and 5, at the present moment, we are keeping an eye on the proportion. We do conduct genome sequencing to establish whether it is BA.2, 0.12, 0.1, or BA.4, BA.5, or BA.2. At the present moment, by comparison with the 21st of June, the number has crept up, but it is still less than 1%. Or in the overall scheme of things, in the light of overseas experience, they are more transmissible. However, we keep an eye on the situation. Next, please, gentlemen over there. Cable TV. The Secretary said, mentioned the health code. Does the Secretary think that this would be helpful in fighting the pandemic? And the case load is hovering around 3,000. In the opinion of the CHP, will this be hovering around 3,000 or so in the near future, or would this be doubling, or would this hit 6,000? Well, I'd like to say again that I don't have any comment on the Secretary's proposed policy. I'm sure that there will be an announcement if there are new measures. Now, for the confirmed cases, we will monitor the situation. Now, the projection is actually on the basis of the trend, the trajectory over the past weeks or so. It is likely to go up, but if people are exercising caution, and if people are socially distanced themselves and venture out less, the increase will be less drastic. English question, please.
Good afternoon, Dr. Chang and Dr. Kwang. So a question from SCMP. So can we know how much manpower is currently deployed by the CHP on contact tracing? Did CHP encounter any difficulties using the Leave Home Safe app to trace all the infected people and their close contacts? And secondly, the CHP has an estimate on the number of infected persons in Hong Kong which did not report their infections to the authorities. Thank you.
We have not done any estimation on the number of underreported cases in the community. And we are using Leave Home Safe app to see whether there is any clustering in the, especially in those mass-off activities in the, for example, restaurants, and to see whether there is any outbreaks. So if there is any outbreak, we will obtain the vaccine pass to trace out those exposed persons.
下一題。
Next question. The lady over there. I'm from Mingpao. Just then, the hospital authority mentioned the hospital Tin Ka Ping infirmary that the 2 wards staff members got infected. What's the link between these cases? Yesterday, the HA mentioned looking into the possibility of stepping up testing for staff members. How often would the staff members be required to get tested? Will all HA staff members required to undergo the same tests? A question for Dr. Chuang. It's a question about the possible real name registration for Leave Home Safe. You said that you will look at the information from the vaccine pass for your tracing efforts. Now, since there is a real name registration for the vaccine pass, is there a need to have a real name registration for Leave Home Safe? I'll take the question first. Now, for the Leave Home Safe app, with the vaccine pass, there's a phone number associated with this system, but we may not be able to get hold of the person if this person does not pick up, or if there's a lack of further information that creates difficulties for us to keep track of people. We don't have the information from the vaccine pass on our side either. When there's an outbreak, we have to reach out to the relevant departments for the information from the vaccine pass. Now, for Tin Ka Ping Infirmary, the 3 workers were still investigating the route of infection. As for testing for HA staff members, before they go to work every day, they have to do a rapid antigen test. And as for the PCR test, we're still discussing this matter. If there's any update, we will make an announcement. Next question, the gentleman over here. I'm from AM730. In terms of tracing efforts and tracing the whereabouts of the infected persons, have you run into any difficulties? You said that the vaccine pass information is not with your department, so there are difficulties. If there's a real name registration with a Leave Home Safe, how much of a help would that be? Now, for the 2 death cases, could you tell us which of them, one of them is the 70-year-old and which of them is the 85-year-old? Can you tell us the health history? Was there any outbreak at the care homes? Mr. Michael Tin said that given the proportion of these cases in the overall caseload, the impact on the overall situation is limited. So as a matter of public health, for Dr. Chuang, if we shorten the quarantine period, would that create a huge risk for the local COVID situation? If there's an infection, we ask the person involved to upload his or her Leave Home Safe records. Once everyone uploads their records, we look for signs where many visit the place and then they get infected to determine whether there was an outbreak. But we cannot tell right away whether a lot of people have been to the same place at the same time. So for contact tracing, that would cause some delays. Now for imported cases and the risks they pose, there are roughly 200 imported cases out of 3,000 cases per day. The proportion is less than 10%. But there's also local transmission, and they're triggered by imported cases that fell through the cracks. In the death cases I just announced, the male patient was 70-year-old. He had kidney cancer and was under palliative care. Upon hospital admission, he had a fever. On July 5th, he tested COVID positive. The CT value at first was 26.5. His condition worsened by July 9th. Because of a cardiac arrest, he passed away. And as for the 85-year-old, this was an 85-year-old lady. She had underlying illnesses, hypertension, and high cholesterol level and diabetes. On July 7th, she had a fever. She couldn't take in food and was in poor spirits, and she was admitted to an A&E department. Upon testing, she was found to be COVID positive. She also had ground glass opacity in her lungs. As for the two elderly homes, I don't have further details on the care facilities. Any other questions? If there's no other questions, that concludes the press briefing today. Thank you.